Hello, I'm Jennifer Capps, the Chief Development and Communication Officer for Mason Health and Mason General Hospital Foundation. And today we're going to talk about our green team, our relationship and partnership with Practice Greenhealth, and our recent Making Medicine Mercury-Free Award.
Hi, I'm Lindsay Roberts. I am the Laboratory Services Manager, and I've been involved with the Green Health team for 2 years now.
I'm Kate Gottlieb, and I'm a Sustainability Strategy Manager at Practice Greenhealth. And so what that means is I have a portfolio of hospitals in which Mason Health is a part of, and I work with them to really brainstorm, implement best practices, share resources, and build sustainability from the ground up. And really exciting, that's the path that Mason Health is on.
My name's Scott Rich. I'm the Director of Growth and Partner Experience at Practice Greenhealth. And for those who don't know, Practice Greenhealth is the leading sustainability healthcare organization in the US and Canada. And we deliver environmental solutions to more than 1,700 hospitals that Mason Health is a part of. And we work with not only hospitals and health systems, but also community health organizations, nonprofits, and the greater healthcare value chain.
Last year, Jen and her team decided to apply for the Making Medicine Mercury-Free Award. The first step is really establishing a policy, and then it's time to kind of do a treasure hunt to see where mercury still lives within the hospital setting. Mercury can be hiding in boiler switches and in the cafe and thermometers, and when a break happens with mercury, the EVS team needs to know how to properly clean it up. We're not telling you to get rid of it, but have a plan in place to phase them out and dispose of them properly. Mason Health went through that whole process and resulted in virtual elimination, winning an award.
The beauty of our membership and our partnership with Practice Greenhealth is that they have a ton of resources, great support, and their process is very robust. The application has several different criteria areas, and within those different criteria areas, you have to dig really deep and pull data and information out. There's a robust opportunity for learning about the organization, learning about different departments, really kind of pulling back and looking deeply, introspectively about the work that we're doing, how we do that work. And with this application cycle for Making Medicine Mercury-Free, it really kind of tested our knowledge. It really gave us an opportunity to really look back at what we started back in 2013 with our major construction project to really look at mercury, making our programs and services more green and more sustainable, but then how do we deepen our knowledge and how do we go a little bit deeper with what we're trying to achieve in terms of eradicating mercury? And I'll give an example, like in the lab, there's only one piece of equipment that has mercury in it, and Lindsay, our lab manager, is working to remove that one piece of equipment in a proactive fashion, and actually she's leading that effort, and we're getting some regional and national attention for doing that work.
The only mercury-containing device that we have left in the organization is a very small sterilization bulb in our DI water system, which seems like it might be an elementary thing to be able to get rid of, but it is one of the only gases still that can be used in a sterilization system. So one of the initiatives that I took on was digging a little bit down into, would I be able to make this mercury-free? Could I get a hold of a sterilization bulb that did not include mercury? So I reached out to the vendor that I was already considering, asked them if they had mercury-free bulb. At the time, the vendor said that they did not, but she had got word that the team was working on developing one. So she asked at that point, do you think there would be further interest in a bulb like this? And I said, absolutely. This mercury-free, Making Medicine Mercury-Free initiative is probably going to get around to other hospitals, any sort of initiative along the same lines where we want to get mercury out of hospitals. So she actually emailed me about a week later and said that the team, after hearing our initiative, and making suggestions about making other hospitals mercury-free, that they are going to go ahead and create and market the mercury-free sterilization bulb. So by the time we replace the system, we will actually be across the organization mercury-free.
I get to see their waste reduction efforts reduce year to year. And each year you just see it going a little bit farther down, a little bit farther down. They're reducing waste, they're repurposing waste, and they're refusing waste. They're just not bringing it into the door. So they might be ordering less, and that's a cost savings.
Thank you to Mason Health and the work that they do and the example that they set. It's really a testament and an example to others, not only around Washington State and the Pacific Northwest, but the whole country. It just shows that if you try and you build year over year, you can make a difference. And so that's inspirational to me. So thank you, Mason Health.
Yeah.